Today, the Pediatric Cancer Day, we all know that pediatric cancers, if not all, some of the cancers are curable, and they are all the examples for cancer survivors and positive hope. And on an average globally, 4 lakh people are affected with the cancers in a pediatric age group of 0 to 19 years. In Western countries, where all the treatment modalities are available and it is being provided in the best way for the best outcome. In developing countries like us, who can be treated with a curative potential may not be available either due to the inaccessibility to the treatment modalities or the non-availabilities or accessibilities to the treatment centers. The gap is getting closer. We are able to provide and succeed in most of the time in these scenarios which are obstacles for our treatment, the best outcome, but still we do face the problems. Most of the pediatric cancers which I mentioned are curables are leukemias, lymphomas and the brain tumors. Sometimes the pediatric leukemias will have different symptoms and can be thought as a joint diseases, or it can be a rheumatism and then will be treated with the steroids, and then that may delay the diagnosis and further treatment. So whenever the children presented with the symptoms, for example unexplained fever, child is having a easy bruisability or non-specific arthralgia, joint symptoms and decreased appetite, activity is reduced, we may have to think of the childhood cancers, especially pediatric leukemias, which are most of the time curable, especially pediatric acute lymphoblastic leukemias. And not only that leukemias, some of the childhood conditions, genetic disorders, immunodeficiencies are also can be treated with the stem cell transplant program which are available robustically and which of international standard which we are providing, and those for all the needy children, finance should not be a barrier. Through various voluntary agencies, all the children who are in need of treatment will be given a social support, logistic support, aside the financial support, so that no children can be devoid of the treatment which is having a curative potential in a pediatric cancer survivor programs. In our centers, we do have a dedicated pediatric intensive care unit and also the bone marrow stem cell transplant unit is for the pediatric patients, and we have expertise. Along with me, there are pediatric hemato specialists are available,